I was 15, I was diagnosed with
Juvenile rheumatoid arthritis.
juvenile rheumatoid arthritis.
It's an autoimmune condition.
This means that my immune system mistakenly identifies its own healthy cells and tissues as foreign.
And when it normally attacks like viruses and sicknesses to defend your body, it attacks its own joints and tissues.
When the condition started becoming active, I became a hermit. I would just stay locked in my room because I couldn't do anything else. Like I just had I didn't have any other choice. I couldn't get pushed around in a wheelchair without it hurting. If I sat in a wheelchair and got pushed around, even the slightest bump would cause excruciating pain.
Like I could, at one point when I was at its worst, I couldn't even fucking dress myself. I couldn't even like get out of my bed. I couldn't even walk to the bathroom.
The condition made me stay home from school. It made me unable to see my friends. It broke my mother's heart to see my normally cheerful attitude turn into a miserable hopelessness. She knew she had to find a solution as quick as possible. So when I saw Dr. Bingham, she immediately admitted me to the hospital because of how severe my pain was. When I was admitted to the hospital, they suggested that I be given morphine just to eradicate the pain right away. I denied this offer because I was scared about the adverse side effects of this medication. I was so used to the pain that I decided that I wouldn't mind bearing it just for a little longer until a safer method of treatment could be determined.
And the way I got off of all that immense pain, that immense like debilitating pain, was by being put on chemotherapy. At one point, I was getting 2 shots in my arm every single week. I had to take pills every single day to counteract the negative side effects of the shots I was getting. And on top of all that, I had to get my blood tested every single month because the medication I was on was suppressing my immune system. So I had to get my blood tested, check my white blood cell count had dropped too low.
After 18 months of medication, my JRA fell into remission. I was able to be pain-free without the use of any medication. However, that only lasted for a few months until my condition became active again. I had to return to life as a pincushion once again. What if I told you that there was actually an alternative to this chemotherapy?
And so my story is about why shouldn't I have legal access to medical marijuana instead of
called methotrexate and Enbrel. They're both fairly effective, but they both had severe drawbacks. Wouldn't you say I have the right to choose to use it for the purpose of improving my health? Would you say that denying me this right is absurd and preposterous?
I'm Dr. Charles Harris. I'm an emergency physician. I did my medical school training at the University of Arizona in Tucson. I did my residency in emergency medicine in Chicago, Illinois at the Christ Community Hospital. And I've worked in emergency medicine since that time. So I've been a full-time practicing emergency physician for about 30 years now, a little bit over. Yes, we do. We see quite a few patients with drug overdoses. Most commonly are drug overdoses from opiates, but also we can see drug overdoses from benzodiazepines, prescribed medications, illegal drugs. Most recently, I saw a patient with a synthetic marijuana overdose.
The President of the United States of America, Donald Trump, just declared the opiate crisis as a national public health crisis. And he also just said he didn't necessarily say this, but it was someone that was a part of his team said that is a $500 billion issue. There seems to be a lot of conversation about how large the problem is, but there seems to be very little, if any, conversation about possible solutions for the issue. How do you think marijuana may be used, or do you think marijuana could be used in any way to potentially offset some of the opiate usage in our country?
Sure. Ben, as we talked about, as you had mentioned during our earlier conversation, the opioid crisis in the country is just escalating out of proportion. It's growing exponentially, and it has been growing for a long time. The reliance of many patients on opiates to help with their chronic conditions, their chronic painful conditions, seems to grow from a lot of different reasons, but largely because we know that opiate therapy, patients tend to develop tolerance to that. So as time goes on, they need higher and higher doses of opiates to achieve the same effect. There are also a lot of bad side effects from taking opiates, especially in high doses, excessive sleepiness, chronic constipation, and the development of tolerance, like we just mentioned, as well as developing syndromes of unusual pain responses. Hyperesthesia is one, where the pain response is so heightened that even small painful conditions or painful stimuli that would normally be rather minor in these patients tend to be magnified greatly. So not only does the drug stop working as well as it should, and you need higher doses, but the effects are the side effects become worse and worse. We do know from research that's been done when they look at, for instance, states that have approved medical marijuana, when they look at the growth of death rates from opiate overdoses, there's been a slowing of the increase in death rates in those states that have approved medical marijuana, anywhere from 23 to 33%, less increase in death rates as would be projected when compared to states that have not approved medical marijuana. When I talk to colleagues in other states that are prescribing medical marijuana, they tell me that between 60 and 80% of their clientele are there because of chronic pain syndrome. And we know from scientific studies that have been done where they look at groups of patients that are taking medical marijuana for a chronic pain syndrome, that they've had reductions in their opiate use of greater than 60% reduction. And I think that's very significant. If you would take that sort of number and spread that across all prescription opiate use in the country, you'd have a dramatic reduction in their reliance on opiates. One of the lecturers that I listened to from Maine talks about his experience on an informal survey that he did. His patients that are taking medical marijuana for chronic pain, he sent out a survey to see what kind of reduction they've had in their opiate use. In his survey, 40% of the patients have had a significant reduction in their reliance on opiate therapy, and more importantly, 40% of his patients have been able to get off of opiates altogether. That's a very encouraging number. That's a very encouraging number. Even if that's only half true, I really look forward to seeing patients that are in chronic pain, that are on chronic opiate therapy, and having a real chance to reduce their reliance on opiates, or more importantly, to get them off of opiates altogether. That would, in my mind, be a medical miracle compared to the path that we're on right now. Back when I was a teen, back in the 60s and in the 70s, growing up in the marijuana culture, we were taught as more and more youngsters were turned into marijuana and other drugs, we were told that marijuana was a gateway drug. And that was the big push back in those years. Marijuana is going to be a gateway. You start smoking dope, and before long, you're going to be dropping LSD, you're going to be taking IV heroin, you're going to be a drug addict, and it's pretty much the end of your life. Looking at the research that we have now over the past 15 or 20 years, we know that marijuana is no more a gateway drug than cigarettes are a gateway drug. We know that marijuana is no more a gateway drug than alcohol is a gateway drug. So basically it comes down to teenagers that kind of misbehave in their teenage years, whether they're using marijuana or smoking cigarettes. or drinking alcohol in their teenage years, we know that those are the same people that are going to be more inclined to going to the heavier drugs and the illicit drug use, such as heroin and LSD and amphetamines and things like that. With the research that's come out, the statistic that I just mentioned, we're really looking at marijuana these days as not so much as a gateway to using heavier drugs. We're looking at it as more as a life-saving portal for patients to be coming from those heavy drugs, especially the opiates, such as prescription opiates and heroin, to getting a marked reduction of those and more of a portal to a more normal life with much fewer side effects and much better control of their symptoms. So there's a lot of hope here in Pennsylvania. I'm really looking forward to working with patients who, as a traditional practitioner of traditional medicine, I've not been able to offer them very much in the way of help and hope for their chronic painful conditions, chronic back pain, chronic neck pain, fibromyalgia, perhaps even irritable bowel syndrome, which is a chronic painful condition, rheumatoid arthritis, juvenile rheumatoid arthritis, things where the treatments, the side effects of the treatments and the possible deleterious effects on their health really outweigh the benefit of the treatment of oral opiate therapy. And if we can get them on something with a much safer side effect profile, a much lower dosage, much less intrusive, to their daily life, such as medical marijuana, I think that would be a real blessing. And that's pretty much what I got into medicine to do, is to help people. We can help this class of patients, which we've been just, pretty much helpless previously, by putting them on a low dose of medical marijuana. I think that the benefit would be tremendous. So I'm really looking forward to getting started in the practice here in Pennsylvania.